In this explainer, we're going to explore how artificial intelligence is already transforming our hospitals and what the future of medicine might actually look like. This isn't science fiction anymore. It's fast becoming a powerful new reality. So, that quote really sets the stage. To understand why AI is becoming so absolutely crucial in medicine, you first have to get a handle on the sheer scale of the challenge we're facing. Look, this isn't about using cool tech just for the sake of it. It's about finding real solutions for a system that's under some serious, immense strain.
So let's start right there with the challenge in healthcare. We're talking about a system under pressure. The demands on modern medicine are, frankly, pushing the limits of what's humanly possible. And that's exactly why AI is shifting from being just a novelty to an absolute necessity.
Okay, and what's really interesting here is how all these different pressures are converging, all at the same time. You've got a workforce that's shrinking, as the baby boomers retire. Meanwhile, the number of patients with really complex chronic illnesses is just going up and up. And then on top of all that, our modern diagnostic tools are creating this absolute flood of data. It's so vast that there's no way a human clinician can process it all effectively. The whole system is literally being squeezed from every direction.
So, given all that pressure, how is AI actually helping right now in clinical practice today? Well, we're going to look at its journey from what you might call the invisible stuff happening in the background, all the way to the visible tools that doctors and patients are using face-to-face. One of the biggest, most frustrating drains on our healthcare system, it's the administrative work, just paperwork. But get this, a recent study found that an AI like ChatGPT-4 can draft orthopedic discharge documents 10 times faster than a person. 10 times! And the quality is comparable. Now think about that. For the average doctor, that could free up more than 2 hours every single week. That's time that goes right back to where it belongs with the patients.
And the impact goes way beyond just individual tasks. Take Houston Methodist Hospital. By using AI to optimize their processes, they increased their operating room capacity by 15%. Another study found a 15% cost reduction. These aren't small, trivial changes. This is a fundamental boost to the whole system's efficiency. And crucially, it's happening without adding even more strain on the staff.
Okay, this brings us to that more visible AI I mentioned, the tools that are working side by side with doctors. And here, the key concept to grasp is this idea of cognitive extension. It's not about replacing doctors, not at all. It's about enhancing their expertise, giving them superpowers, if you will, while the human doctor always remains in control.
And there is no better example of this in action than radiology. Radiology generates almost 90% of all the data in a hospital. Think about that. This massive volume of visual information is basically the perfect fuel for AI algorithms. It's all about turning a giant sea of pixels into precise, actionable insights. So, in radiology, AI delivers 3 huge advantages. First, speed. It shortens scan times and just accelerates the whole diagnostic process. Second, precision. It's like having a second pair of expert eyes that never ever get tired, highlighting things a human might miss. And third, consistency. This is a big one. It ensures that you get the same high level of analysis whether it's 2 in the afternoon or 2 in the morning.
All right, now let's step into the operating room. This is where you see systems like the famous Da Vinci robot. They work on a principle called telemanipulation. So picture this. The surgeon isn't actually standing over the patient. They're sitting at a console nearby, controlling the robot's arms. Their hand movements are translated into these tiny, micro actions with just incredible, superhuman precision.
And the advantages here are pretty clear, right? You get higher precision than any human hand could manage, much smaller incisions, which means faster recovery for the patient, and it's actually better for the surgeon's posture and comfort. But, and this is a big but, there are significant challenges. These systems cost millions of dollars. They require a ton of specialized training. And maybe most crucially, surgeons lose that sense of touch, that haptic feedback that has guided their hands for centuries. That's a huge change. Maybe the most profound change that AI is bringing to medicine isn't even technological. It's human. It's fundamentally reshaping the entire conversation, the whole decision-making process that happens between a doctor and a patient.
See, for decades, medical decisions were what you'd call a dyad, just a two-way conversation between the doctor and the patient. But now, we're moving towards a triad, or maybe even a quartet. You might have the patient coming in, already armed with information from their own AI tool. And the doctor, of course, is using their AI for clinical support. Suddenly, the whole conversation becomes richer, more complex, and way more data-driven.
And this little story perfectly illustrates the goal of this new model. It's called shared decision-making. So take the case of Frau Mueller. She has knee osteoarthritis, and she's convinced she needs a knee replacement. But then her doctor asks this simple but incredibly powerful question. What do you want to be able to do again? And it turns out her real goal wasn't just to be pain-free, it was to be able to garden. Well, a knee prosthesis would have actually made that harder, with the bending it requires. By focusing on her actual goal, not just the diagnosis, they found a much better non-surgical path for her.
So, where is all this headed? What's the next step? Well, the future of medicine is increasingly being seen as essentially an information science. And in the very near future, we might see totally new professions pop up. For instance, there's this concept of the G-coach or health coach. This would be a specialist, someone who helps patients manage all the data they're collecting from their wearables and apps. They'd make sure it's high-quality data and that it's actually integrated into their care plan. They basically become that essential human interface between the patient, the doctor, and the AI. But if we look even further out, the ultimate kind of mind-blowing vision is the digital twin. Just imagine a complete, dynamic simulation of your body, from the cellular level all the way up to your organs, constantly being updated with real-time data from sensors. Doctors could then test treatments on your virtual twin first to see exactly how your specific biology would react. That's personalizing medicine to a degree that was unimaginable just a few years ago.
And in a world like that, the role of the doctor transforms completely. They become less of a diagnostician and more of an interpreter, a highly skilled information scientist who can translate the incredibly complex predictions of the digital twin into a practical, humane care plan that actually aligns with the patient's real-life goals, just like with Frau Miller and her garden. Because ultimately, this whole journey isn't about choosing man or machine. It's not human intuition versus artificial intelligence. The real goal is a synthesis. It's about combining the incredible analytical power of the machine with the empathy, the wisdom, and the complex reasoning that only a human can provide. That fusion, that's what's going to define the next standard of care.